We are the only national ambulance service in Wales, providing a service to over 3 million people. We have evolved to become one of the most clinically advanced ambulance services, with a focus on ensuring all patients receive quality services and care. They are all supported by our patient experience and community involvement team. This team are responsible for going out into communities, listening to people, talking to them, capturing their experiences and expectations, and identifying ways to make improvements. Throughout this last year, it has been essential that we have remained visible and in contact with all patients across Wales. And we have invested time to sustain the relationships that we've built up over the years through our continuous engagement model with them.
Overnight, our working practices changed, but people's need for help, advice and information didn't. We needed to ensure continuity of engagement, access to relevant information and having a point of contact with the organisation for communities. We didn't want people to feel abandoned when the announcement came to stay home, self-isolate and only use the NHS for emergencies. We heard that people with genuine emergencies were not contacting 999 when they should be. This was because they had fears about coronavirus. They were telling us they didn't want to put pressure onto an already pressurised NHS system and people just didn't want to go into hospital. For many others, they were telling us that they were confused by messages and information that was being delivered to them, and that they were also struggling with the isolation that lockdown and being stuck at home was bringing. From our previous engagement, we had anticipated that certain groups within the community would be feeling the pressures of the loneliness and isolation during lockdown much more than others, especially those with learning disabilities, people with dementia, and those living with sensory loss. We wanted to make sure that we addressed these issues and that we were able to share what we'd learned previously with other organisations across the NHS in Wales.
So in order to ensure that we continue to engage with the public, we moved all our engagement online. We use a variety of channels to do this. We invited community groups to meet with us and to continue to have the dialogue. And through the online engagement, we heard very early on about people's fears around PPE. The PPE that our staff were having to wear were causing a number of communication barriers. So for example, for those with learning disabilities and dementia, it concerned them to see people turning up in various levels of PPE when they were already in a very anxious or frightened state. For people with sensory loss, they struggled to communicate. They found it very difficult. They couldn't lip read when somebody was wearing facial PPE. And again, they just felt that they were being excluded from accessing appropriate information. Information that was being made available at the time did not factor in the needs of people with dementia or learning disabilities and ensure that information was in pictorial or easy read form. And for those with sensory loss, there was no information in the early stages that was done in large print or British Sign Language. For children and young people, again, information not being made available and on platforms that they frequented on a regular basis. Our response to what we were hearing was to ensure that we shared what people were saying around their experiences. We engaged with colleagues not only across the NHS but third sector and local authority, as well as public health and through Welsh Government. We were able to influence some of the messages that were coming out and certainly the style and visual elements of the information. We ensured that all information wasn't just bilingual but was also available in British Sign Language, that it was in an easy read format. And through the online engagements, we were able, through the use of animation, to convey some serious messages in a much more fun, relaxed and informed way.
The challenge with patient experience is that it's often difficult to measure the impact. But what we've demonstrated is that engaging and championing the public is not a one-off activity. It needs to be something that's integrated into the bigger system. In our case, part of a continuous engagement model. We engaged, listened and involved people in developing and disseminating information and captured feedback on how this had been received by communities. The public is not one homogeneous group, but is made up of many characteristics and needs. A one-size approach to communication and engagement and information production does not work, and you have to consider the reach and accessibility of your information and your organisation.
In looking at the bigger picture and how we as a service impact on people from an equality perspective means that we no longer engage with groups as a particular characteristic. Instead, we look at whether our services, information and systems reflect the needs of all in our community.